Hi, my name is Patty and I'm going to be doing your assessment today. For the purpose of this video, we're going to start off with some hand hygiene. I just want to make sure that we are free of germs. I'm going to be using my hands to kind of touch and assess here in a little bit, and I just want to make sure that I'm clean for you. We're going to go ahead and get started. Can you tell me your name?
Yes, Shanice.
Can you tell me what the date is today?
Yes, it is February the 1st, 2022.
Okay, and what city are we in?
Waco.
Okay, the next thing I'm going to do is test your hearing. I'm going to whisper a phrase into your ear, and I'm going to have you repeat that back to me. Do you have any difficulty hearing?
No, I don't.
Okay, we're just going to check.
Red brick.
Perfect.
Train track.
Great. Okay, the next thing that I'm going to do is test your ability to breathe in and out through your nose. Do you have any difficulty breathing, any congestion?
No.
Okay, so the first thing that I'm going to have you do is take your hand and just block one nostril, and I'll have you inhale and exhale. Perfect. And now if you'll repeat the process on the next side. And exhale. Great. The next thing that we're going to do is I'm just going to feel for your lymph nodes. Okay, so first we're going to do the postauricular, right here by the ears, and then the mandibular and the supraclavicular. Everything feels great. The next thing I'm going to do is test your extraocular eye motions or movements. I'm just going to have you take a look at the tip of this pen and follow it with your eyes only.
Okay.
Don't move your head in any way, okay? We're just going to move through the 6 cardinal gazes, okay?
Mm-hmm.
Perfect. Very good. The next thing that I'm going to do is I'm going to listen to your heart and to your lungs. I'm going to do this over your clothes. Normally we would do that on skin to skin, so I would be able to hear a little bit better, but for this video we don't need to do that. Okay? So I'm just going to listen. Just breathe normally. I'm just going to listen to your heart. Go up and under. Perfect. Now I'm going to listen to your lungs. You'll just take a deep breath in and out. Again. And out. Now I'm just going to listen to the sides right there. Perfect. And one more. Now I'm just going to come around and listen to the back. Can you just breathe regular for me? Just in and out. Perfect. Everything sounds clear. The next thing we're going to do is just test your muscular strength. The first thing I'm going to do is test the strength of your head. I'm going to use my hands. I'm just going to have you lean into my hands. You'll lean forward, then backwards, and we'll kind of check side to side, okay?
Okay.
So if you would please just press forward with your head against my hand, and backwards. Great. To the side, and again. Perfect. Now I'm going to test your shoulder strength. I just want you to shrug up against me, okay? Great. Perfect. The next thing I'm going to test is the strength in your hands, your knees, your ankles, and your feet. So first I'm going to have you squeeze my hands and check your grip strength. Perfect. Then press up against my hands. Resistance, okay? And do the same thing going down. Perfect. Now I'm going to have you press away. Put your hands in the middle and press away from the middle. Perfect. Now I'm going to put my hands in the middle and I want you to resist me. Great. Perfect strength. The next thing we're gonna check is your knees. I'm gonna hold my hands on my knees and I'm gonna have you lift your knees up, okay? Go ahead and lift up against me. Perfect. Now we're gonna check your ankles and your feet. This is gonna be, I'm gonna put my hands behind your ankles, and at the same time, I want you to just kind of push your feet back against me. And then I'll place my hands on the side, and I want you to try to spread your feet apart. Does that make sense?
Mm-hmm.
Okay. Pull your feet up for me. Go ahead and press against me. Okay, now pull apart. Great. Now can you push your toes up to the sky and then push against me like a gas pedal? Perfect. Strength is good. I'm going to go ahead and use some of this since I was touching the bottom of your feet. The next thing we're going to do is the Tinetti assessment. I'm just basically going to assess your ability to walk, your gait, your balance. I just want to see how much of a fall risk you are. So the first thing I'm going to do is have you stand straight up. Perfect. Now, can you spread your feet about 4 inches apart? Great. So now I'm going to have you put your feet back together. I'm going to have you close your eyes, and I'm going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The next thing that we're going to do is I'm going to do the nudge assessment. I'm basically just going to take my hand, press against your sternum, and press against you and nudge you back. We'll do it 3 times. I'm just going to check and see how well you're able to stay standing for me, okay? Are you ready? 1, 2, 3. Perfect. You did great. Okay, so the next thing that I'm going to have you do is just turn 360 in a circle. Just any direction you want to, just turn fully around and face back to me. Perfect. Okay, now I'm going to have you sit back down, make sure you're fully in front of your chair. Did great. That's awesome. The last thing that I have for you is we're just going to stand, and I'm going to have you take 10 steps this direction and 10 steps back to me. Now for the purpose of this video, it's probably going to be more like 5 steps, but as many steps as you can get this direction and back.
Okay.
Go right ahead. Great. Okay, so go ahead and have a seat, and I'm gonna talk to you a little bit, ask you some questions. Now I noticed you were really steady on your feet, so you don't use anything like a walker or a cane or any type of device to assist you in any way?
No.
In movement? Good. I noticed as we were looking around your apartment earlier, you don't have any rugs or any trip hazards, and that's great. Do you have any pets? I didn't notice any.
No, I don't.
Okay, so when we have animals, they tend to get up under our feet, and they can cause falls and increase our risk for getting injured. I know that I don't see any toys or any children, but I know you have a nephew. So just some things to think about when he comes over and plays. Just kind of keep your area tidy so that you're not tripping and falling. And also, do you take medications?
Just some over the counter.
Okay, so where do you keep those?
I keep those in my medicine cabinet.
Perfect. So always keep those things away from children and up high. We just want to keep safety in mind. Last but not least, I know that based on our discussions earlier, you don't have a lot of medications, but if you did have medications, do you know who to contact or who to talk to if you were needing help getting those?
Yes.
Would you call your doctor?
Yes, I'll call my doctor.
Okay. So always, if you have medications that you can't afford and you're needing help, your first resource is always going to be the physician that prescribed them. Give them a call, see if they can do anything to help you out in order to get those medications that you need.
Okay.
So I am done with my assessment. Do you have any questions for me?
No, ma'am.
Perfect. My name is Patty, and this is Shanice, and we just completed our assessment. Thank you.